Well, hello and welcome to another clinical case vignette with Dr. Childress. In this particular vignette, I'm going to be discussing the Williams family. This has a targeted parent father and an allied parent mother. So we're going to be over in the borderline vulnerable dark triad pattern. And this family has three children, three adolescent children, led by a son who's 16, a daughter who's 14, and a daughter who's 12. So to begin with, just the features of the Williams family. Again, we have an allied mother and a targeted father. Three children, 16, 14, and 12, with a son at the top, the eldest son, and then two daughters beneath that. It's an early development of the pathology, 2 years post-separation, and we don't have any step family or step issues involved. So here's a genogram for the family. Again, I recommend genograms to help organize our understanding, and they will become helpful particularly helpful when we get to step families. So we have Mark at age 16. He was the oldest son, and then followed by his sister Emma, followed by Lauren at age 12. And the first thing to note about this family is this is a long-term family that we've had, since 27, 18 years with this family, and it's recently broken up. And so that's one of the considerations with this. This is not a recent divorce, a recent marriage and one child and then a divorce. This family was together for quite a bit of time. The second thing to notice is just about the pattern itself, without any additional information, just the pattern, is we have the eldest son who's in the launching phase. So he's 16 to 20, so he's going to be going out into the world. That's called the launching phase. Parents should be giving them a platform to push off of. Now, in this particular pattern, the mother is likely to collapse the platform because she's using the son as a regulatory object. So he's likely to have a failed launch in this particular pattern. And the other feature about this pattern, though, is as he's moving into launching and leaving the home, we're going to be therapy-wise at helping bonding, and so it's the kind of cross purposes developmentally at this point. The other feature about the family is we've got the youngest is pre-adolescent. So, and this is relatively recent divorce, so we have to fix this problem. If we have just Mark at the lead, there's questions whether he may age out of the court's control by the time everybody gets around to doing anything. We need to get faster on how we resolve problems. However, that becomes a consideration when you have 16 and he's saying, I don't want to be with my dad. Well, people start to listen to him maybe, and he's going to be going into the world. Whereas we have a 12-year-old down here. So this is going to be a family issue for a while, and we want to give both Emma and Lauren a normal range adolescence here, where they're not worried about their family conflict and things. So we have to resolve this relatively quickly. The other feature to notice about this pattern is we have the father on the high affection cross-gender bonds with his daughters. So it's two cross-gender bonds that are high affection, father-daughter, mother-son, two identity bonds, same gender. That's father, son, and mother, daughter. So we have the father on the same gender values and identity bond with his son, father-son bond, and the cross-gender high affection bond with his two daughters. The mother, conversely, is on the high affection bond with this son, and that has implications for the pattern. And then the same gender values bond for the daughters. So what the mother is doing in this pattern, in this particular pattern, the cross-gender high affection alliance against the other parent, she's using the son as a warrior against his father. Classically, this is called the Oedipal, victory, where the son defeats his father for the mother's special affections. And so it's got a kind of a creepy, over-involved feel to it that we need to get separation a little bit, psychological separation from the mother, and reestablish that father-son, healthy father-son bond. Another feature about this particular pathology or this particular pattern, if we're in the borderline spectrum, vulnerable dark triad is we're going to get the presentation by the mother of being a virtuous victim. And so that's going to be potentially one of her manipulative things of how she was such a wonderful mother and such a wonderful spouse, and she's a victim of this evil person. So the virtuous victim presentation is highly manipulative. Another feature about this particular pattern is that when I got a targeted dad, I'm going to have a wonderful dad treatment plan bullet point, both for the assessment and also for the treatment. I want a wonderful dad for his 2 girls, and everybody's going to be saying, "Oh, dad's a problem," so we'll fix dad, whatever it is, and we'll make him into a wonderful dad for his kids, and so that'll be terrific. Except for the mother. The mother's not going to want that bullet point on the treatment plan. So what we're looking at here basically is that the family is not gone. There's always a family. The moment you have children, there's always a family. There's a mother, father, and a child. The family is merely transitioning from its former intact family structure that was united by the marriage to now they're in a separated family structure that's now united by the child's bonding to both parents. Now, one of the things to notice, though, is in that intact family, the children can kind of float around, whereas in a separated family, they're kind of locked into that role. And so it becomes very problematic if there's a lot of conflict in the parents and it rips the family apart because that child in that unifying role is feeling all that tension because their role is to hold the family together. Meanwhile, a parent is ripping the family apart. And that results in the pathological cutoff family. And that's what we want to avoid. We want to avoid where the child's over with one parent and away from the other parent. So the question becomes, for the court's consideration, is which parent in this family is most likely to lead this family into a healthy separated family structure versus a pathological cutoff family? And then we want to support the leadership of that parent and diminish the leadership or resolve the leadership, shift leadership over to the healthier normal range parent. So the presenting problem in this family is that following the divorce, the eldest son and father began having frequent arguments, one of which resulted in the father taking the son's phone away, which then led to some low-level pushing. That's the unforgivable event. So an event occurred. Now, it'll change with different family contexts. It'll be this event or that event or something that happened around the separation or divorce or soon after that becomes the unforgivable event that is used to justify all current and future rejection. And then the son at that point went over with his mom's to his mom's house after this conflict with his dad, saying that his dad is too angry and controlling. Now, the father has not seen his son since this event, so it's been approximately 2 years. And the mother asserts that the son should be allowed to decide on visitations with his father. The 2 younger children have maintained the post-divorce court-ordered 50-50 custody schedule, although the middle daughter has started to started protesting the visitations as well. So what I'm going to start with here talking about is the 12 associate clinical signs. Now, these are on the checklist for pathogenic parenting, and I've got videos and things about them. And these are not diagnostic features, but they are often present. And what they help in doing is both screening. So right at this initial phase, we're worried about this is, 16-year-old son and parent-child conflict with a son going into launching. That's relatively within the scope of normal range development. We see more conflict in adolescence as a child begins to separate and launch. The question becomes, is the mother influencing that and using that? And we got the whole delusional thought disorder, factitious disorder thing going on. And one of the ways that's helpful is you listen for the 12 associated clinical signs of pathogenic parenting. If it's just normal range developmental conflict, you're going to find that in applied behavioral analysis and things, and you're not going to get the 12 associated clinical signs. You won't see these symptoms. But if it's pathogenic parenting, you're going to see not just any one symptom, you're going to see a lot of them. Okay. And that's one of the things, because any given symptom here, almost any of these, can show up in other cases. But when you see a lot of them all together, and there's reasons for each one of these, and I talk about the reasons over on my videos and stuff. So the first one is the use of the word forced. So if I'm predicting word use. That's how precise I am with this pattern. So the use of the word forced, then empowering a parent who empowers the child to reject a parent, the exclusion demand that the child doesn't want the parent at their sporting event or plays or graduation, those sorts of things. Parental replacement, calling the parent by the first name or a step parent by mom or dad. The unforgivable event, some event that is used to justify all future and past rejection or future and current rejection. Use of the words liar and fake. So when you talk about the affection of the targeted parent, they say, he's a liar, that's just fake. Then there's a certain set of themes that are characteristically used for the rejection. Unwarranted use of the word abuse, that's over primarily with the borderline vulnerable dark triad. Excessive texting and phone contact between the allied parent and child while the child is with the targeted parent. Role reversal, that's where you put the child out front. It's not me who wants this, it's the child who wants to be a dancer. It's a child who wants to go to this school. It's not me. And so that's a role reversal, putting the child out front. And then the theme that the targeted parent somehow deserves to be rejected because of their inadequacy or failure or so. And so that's the classic spousal abuse theme. That, yeah, of course I hit her. She deserved it. My dinner was cold. And so that deserves to be, deserves a cruelty. And then number 12 is a disregard of court authority. And so I have a series on this where I talk about each of those 12 associated clinical signs, why we see them, and what their origins are. So in this particular family, we have quite a few of them. ACS1, the mother says, Mark shouldn't be forced to be with his father. And so the moment she says that in an interview or something, the use of the word forced, click, that's a check mark. Now, does that mean it's pathogenic? No, it doesn't mean it's pathogenic parenting. However, if there's a lot of these ACS, then that supports the diagnosis. So ACS2, the mother says, Mark should be allowed to decide if he wants to see his father. So there, she's empowering the child to reject the parent. ACS3, Mark doesn't want his father to attend his baseball games anymore because he feels stressed out. They stress him out. And now that's not him getting stressed out, that's his mom, and he's tied into his mom and stuff. But ACS3, the exclusion demand, is pretty much diagnostic. If that's present, it's pretty much pathogenic parenting, because all children want their parents to be at their sporting events and stuff and be watched and stuff. That's a really, really weird symptom, and is only associated with pathogenic parenting. ACS5, that phone incident of taking the phone and pushing and stuff, that represents the unforgivable event. In the past, it's justifying all current and future rejection. ACS7, the reason for Mark's rejection is that the father is too angry and too controlling. Those are on the list. Now, could his father be too angry and controlling? Absolutely. But so these are not diagnostic. We're just saying how many of these are present. And then if there's a lot of them, they have to be explained somehow. So then ACS9, the mother is continually texting Emma when the girls are with their father, and she's asking Emma to watch out for Lauren and make sure that Lauren's okay. So she's putting Emma in a protective role. And are you guys okay over there? And Emma's checking back. Yes. And he's treating Lauren okay, but he didn't give us a proper lunch. And so mom and Emma are just talking all the time with Emma in a protective role for Lauren. Then we have the mother states that I tell Mark to go to his father, so he should have a relationship with his father, but it's his decision. What can I do? I can't force him to go. And so they start to use the forced with other things. I can't force him to go. He should be allowed to decide on it. but she puts the child out front instead of saying, I make the child go and assert her authority. She becomes a inadequate parent. She becomes an incompetent parent. I can't make him go to be with his father, and puts him out front. It's his decision. That's the classic symptom of a cross-generational coalition, that role reversal. Then ACS 11, that Mark and his mother maintain that the father deserves to be rejected because of his failure as a father. So if I talk to Mark about, so Mark, what's going on? Why don't you want to be with your dad? He'll tell me some issue that dad deserves it because he, took my phone away and he wouldn't listen to me and he's too controlling. He deserves the cruelty. And that's your narcissistic value. Let me just talk about that. There's a characteristic and classic sign of this. It's a narcissistic value system taught to the child by the narcissistic parent, which is it's okay to be cruel to people if they deserve it. That's not true. We're not nice to other people because of who they are. We're nice because of who we are. And so, but they give this the permission to be cruel. That's the absence of empathy. Absence of empathy is a capacity for cruelty. We don't want to see cruelty in a kid. And so if I've got a kid saying and doing cruel things, I'll point that out to the kid and say, wow, that's kind of a cruel thing to say. And they will respond with some variant of, yeah, but they deserve it because they were inadequate. They didn't please me, in sense of entitlement or something like that. So that deserves symptom worries me about the spousal abuse component, because that's a classic theme of spousal abuse. And then number 12 is also present, is that Mark and his mother are disregarding the court orders for shared custody. So here we have in this family 9 associated clinical signs out of 12. Okay. And so that's how already, just if I know that, then I'm worried going in that this is not the normal developmental thing. I'm worried about the pathogenic parenting because we have all these associated. Are they diagnostic? No, but they are associated. So then the other thing I recommend you do is the checklist. We just go down the checklist of diagnostic indicators. Now, I don't need these. I can diagnose the pathology without a checklist, but I'm providing this from my knowledge to document the symptoms, because this is going to be a disputed diagnosis. So are these 3 symptoms present? If these 3 symptoms are present, then there's no other way to explain them than other pathogenic parenting by the allied narcissistic borderline parent. And the 3 symptoms are diagnostic indicator 1, these are diagnostic, are attachment system suppression towards a normal range parent. Children want to bond to normal range parents. It's a motivational system. So if we have attachment suppression or a child seeking to flee a normal range parent, that's a false or factitious attachment pathology, because that's not how the brain works. It's a motivational system that wants to bond. So if you have a normal range parent, the child will bond into that. If you have a problematic parent, you get insecure attachment where still the child wants to bond. Children do not reject normal range parents. So that's your factitious disorder. Then diagnostic indicator 2A, there's 2 of these. One is that there's narcissistic personality traits displayed by the child. Grandiosity, the child is judging the parent. Adequacy of the parent, a sense of entitlement. They should have their needs and wants and desires immediately satisfied. The absence of empathy, and that's where you look for the cruelty in the child. Is the child cruel? And that's a very distinctive symptom, and it's not one we want to see. And then the haughty and arrogant attitude from the child, and then splitting, the all good, all bad, and very restrictive change. Change just doesn't happen. They're very controlled. Once things are defined, they don't change. That's a symptom of splitting. And so the splitting and the absence of empathy are the 2 that are of high concern. And then the 2B is phobic anxiety. That's persistent unwarranted fear, severe anxiety response like panic attacks, and then the avoidance. And what those 2 are is diagnostic indicator 2A is the psychological influence on the child of a personality disordered parent. because children don't have narcissistic personality disorder, but I'm getting a display of narcissistic symptoms in a child. That's because they're being psychologically controlled by a narcissistic parent. Now, the other variant of that is when you're on the borderline spectrum, sometimes they will create this massive anxiety response where the child's afraid of the parent and having panic attacks and stuff. They create a father phobia, okay, specific phobia. And so, depending on the situation, you'll see one or the other. You'll see the narcissistic influence, or you'll see the borderline influence. In this particular case, we're seeing the narcissistic influence. Mark has a haughty and arrogant attitude towards his father, a sense of entitlement that his father should meet his needs to, Mark's satisfaction. He's judging down the parent. Most importantly, though, he has that cruelty. He's saying and doing mean things to his father because his father deserves it, and that's the problem. And then the splitting. His mother is wonderful. She's so nurturing, and she's just the ideal, wonderful parent, which is what she wants everybody to see her as. And so she's using him to present that. So and his father is evil and bad and all, and there's no middle ground either way. One's wonderful, the other's demonized. So those are those two symptoms. Those are the symptoms of personality disorder, parent in the family. Then diagnostic indicator 3, which is the child has a persecutory delusion towards the parent, towards the dad, a fixed and false belief that the child is being malevolently treated in some way. So if you have a child with a delusion towards a parent, persecutory delusion, and, narcissistic or borderline display of that the parent's controlling them, and a factitious attachment pathology in the child, there's only one possible diagnostic explanation for those 3 symptoms. Now, how I explain this is like a puzzle. You're putting together a puzzle, and we're putting together cats in the garden. That's what we're worried about. We're worried about trauma. We're worried about trains in the mountain or something too. But the one we're worried about with this is cats in the garden. Do we have the factitious disorder, delusional disorder? Now, that particular puzzle, cats in the garden, will always have 3 pieces to it. Okay, and a lot of these other pieces, the 12 associated clinical signs, but it will always have these 3 pieces. And so if you see these 3 pieces, it's going to be cats in the garden. There's going to be a little piece over here that's kind of red and has this, and there's going to be a piece over here with a little green and a little fur on it and stuff. Now, do we make the diagnosis based on those 3? No. We put the puzzle together, and guess what? It looks like a picture of cats in the garden. I can see a watering can. I can see little birds. I can see, the 3 cats playing in the garden. So we put the puzzle piece together. But it's useful to document. Boom, boom, boom. Please just document these symptoms. And it's really simple. Document them for the court, document them for other professionals, and say these are present. There's only one explanation if these are present. And then you add 9 of the 12 ACS, research with 46 court-involved families. Took a look at 46 court-involved families with these 3 diagnostic indicators. All 46 had these 3 diagnostic indicators. We were looking at the associated clinical signs, the frequency of those. All 46 families had 5 or more associated clinical signs. 45 of the 46 families had 8 or more. This family has 9 or more. So it's definitely in the pattern here. I just have to go down and check my checkbox, and there's pretty much the only one explanation. Now I can do a mental status exam of thought and perception and do applied behavioral analysis and figure it out. Now, the assessment of the father's parenting is what we're going to want to do first. There's allegations that he's overly hostile and angry and controlling. So we want to take a look at that. Is that a true belief, or is that a false belief? Is the dad a normal range dad? Now, remember, the child can be provoking the father, and then the father gets angry. Don't talk to me like that. And then the child says, "You're so angry." That's your classic borderline thing, where the woman provokes the guy, does something, and he gets angry and then says, "You're so angry," And so you have to be careful of that manipulative thing of the child provoking. That's why you want to do an applied behavioral analysis. See what the cue structure is on that. See if the father is actually angry and controlling, or whether the child is oppositional, defiant, provoking, those sorts of things, haughty and arrogant attitude, sense of entitlement, grandiose judgment of the father, critical, all these sorts of things that are creating this. So you'll want to, again, document this. It's not an assessment, it's just documenting the symptoms, because we're going to want to act with certainty, either to put the father's problematic parenting on a treatment plan, identify what it is. He's too controlling, he's too angry. Okay, let's soften him up and then everything should be fixed. Or is he a normal range dad, level 3 or 4, in which case this is, part of the pathology is that, I'm being malevolently treated by my normal range dad. And so we want to document that level 1, 2, 3, or 4, with level 1 and 2 being abusive range, in which case we're worried about the dad's parenting, or level 3 and 4, which is normal range, in which we're worried about child psychological abuse by the mother. You want to do a behavioral analysis, especially with this family, especially with Mark and his dad. You take 2 or 3 of the most serious incidents of father-son conflict and conduct an applied behavioral analysis. You look at things before, during, and after the event, thinking, feeling, and action. Thinking, feeling, doing, before, during, and after. And you just walk it through. What did you do? What did you do? How did you respond to that? That's a behavior chain interview. You just walk it back and forth between them, and you're looking at what's cueing it, also what's reinforcing, and potentially the function of behavior, but you're primarily looking at what the cue is for the misbehavior, because that's what you're going to change in your behavior therapy, is what's cueing the problem. Now, I have a video seminar up on assessing parenting, so I'm not going to go over how to assess the father's parenting, but you want to do that. Okay, you want to rule out that the father is authentically hostile, controlling, which would then put this in sort of the normal developmental range. The child is seeking to separate from a father who's overly controlling, and so we get in some protest behavior. And it's kind of normal range, and we need to fix that. Or are we in a factitious disorder and delusional thought disorder by the mom? Factitious disorder, attachment pathology, problem in love and bonding is a diagnosis made by rule out. So we want to rule out the father as being abusive range parenting. The other thing I will recommend on this is a Roberts apperception test for children. Now, I would not do this in any of the diagnostic assessments. It's not diagnostic. We don't need it for diagnosis. However, it's a wonderful measure for getting insight about the children's and what's going on for them inside. So as we enter treatment, I might consider it with the Roberts. Now, I probably won't do the Roberts with Mark. He's 16 years old. He's a young man going out. I'm not as worried about how he's handling the stresses, because he's going to be in a different zone developmentally and where he's at in the world. It's the 2 girls underneath that I'm worried about. If there's continued stress, and if the family conflict stays, or if there's things I'm worried about in therapy relative to the 2 girls, I might consider Roberts to take a look at how they're kind of organized inside and the stresses they're feeling. With court-involved clinical assessment for attachment pathology, a child rejecting a parent, that's a risk assessment for possible child abuse to a differential diagnosis for each parent. Is the father abusive in some way, creating the child's attachment pathology towards him, an authentic attachment pathology? Or is the mother psychologically abusing the child by creating a shared persecutory delusion and factitious attachment pathology? So I got one diagnosis, child abuse, one way or the other. So this is a risk assessment. And court-involved risk assessments for child abuse need to be completed within 6 to 8 weeks. I would prefer 4 to 6 weeks, but 6 to 8 weeks would be sort of the outside limit for a risk assessment for this type of abuse. So in this family, and this will be important to understand for all the mental health professionals, in the absence of child abuse, Parents have the right to parent according to their cultural values, their personal values, and their religious values. And in the absence of child abuse, each parent should have as much time and involvement with the child as possible. Mothers are unique to their sons and unique to their daughters. Fathers are unique relationships to their sons, father, son, and unique to their daughter, father, daughter. None, those parents are not interchangeable or replaceable with each other. And in the absence of child abuse, to restrict either parent's time and involvement with the child would damage the child's attachment bond to that parent, thereby harming the child and harming the parent. So now the mother's going to be making claims that she's a more nurturing and wonderful parent, and that the father is too hostile and controlling and angry. Because did she provoke it? The kid, do they provoke him into the anger and then say, you're too angry? But that's this statement that he's too angry. Now, is it child abuse? Because if it's not child abuse, then maybe they're provoking it, and he's got his right to his values. And so he may be a little bit more on the structured area where he likes rules, and kids follow rules, and that's totally normal and totally fine in all normal range families. But she might be on the permissive spectrum where she lets the kids get away with stuff, and that's relationship building. She just lets them get away, and she's soft and nurturing while he's rule bound. She's setting them up to be the bad guy. And then she can come in and say, oh, he's so, hard on you and stuff. But it's because she's looking at him from a permissive spectrum, and he's normal range on that. So we need to be careful about getting caught in the contagion of the mother's delusion and the mother's, borderline stuff and manipulation and victimization role, vulnerable dark triad kind of thing. And if it's abusive, then we need to do something. If it's not abusive, it's within the scope of personal values, cultural values, religious values. So that's an important component to keep in mind. So what we're looking at here on various features, we're looking at a potential borderline vulnerable dark triad mother, and that's going to entail, what we'll be listening for is the virtuous victim presentation. That's a classic manipulative presentation by the dark triad personalities. The narcissist will present as a virtuous, but not as a victim, because they are grandiose. The psychopath will present as a victim, but not virtuous, because they don't know how to be virtuous. The dark personalities will present as both virtuous and victim, and the borderline vulnerable dark, and because that is highly manipulative, draws people in and makes them protective and stuff. The other feature about this vulnerable dark is this is the incest pattern, the cross-gender bond that excludes the other parent. And so in this one, she's using the son as a warrior against the father. And that's your Oedipal cross-gender one. So if we switch over to the other cross-gender, that's the father and the daughter again, that excludes the mother, a special relationship with the father and the daughter that excludes your mother. That's the psychological incest pattern over there. If we come back to the other cross-gender, that's what we have here, the mother and son against the father. The son, she's using the son as a warrior against his father. So he's going to defeat his father for the mother's special affections. And that's your Oedipal pattern out of Freudian kind of stuff. So that's kind of got a creepy feel, and we need to get boundary separation. We need to get a solid, affectionate father-son bond to balance the high affection that's coming off the mother-son bond. The other feature about that mother-son bond here in this is that high affection bond glows white hot in early childhood. Okay, that mother-son bond that's huge. In adolescence, though, not so much. Okay, the son is kind of moving out into the world, and he's becoming a young man, and so we're going to have a higher involvement of the father-son bond as sons in adolescence. And so here in this family where we have a son rejecting his father, that's like his identity. That's not only that, but the cultural lineage, family lineages and stuff, that he's rejecting half of himself, and that's the identity half, that we need to fix it. Okay, we need to get that father and son back to where we have an idealization of the father, and that he feels good about being a man, and various things like that. So we want to restore this with the family and not leave it a breach where he's over with his mother and launching in the world. Now, this is a little gender based, but the woman's energy tends to be around hearth and home, whereas male energy tends to be more out in the world. And so when we're talking about launching into the world, that's more of a male energy versus a female energy of hearth and home. With a vulnerable dark triad borderline, we're worried about mom collapsing his platform for launching because she's using him as a regulatory object. She's using him as a surrogate spouse, and so meet her own needs and for intimacy. And so she'll collapse that, so he'll have a failed launch. Now, the other feature is he's up at 16. He's running into court limitations on when the court can influence him. And at 16, they may say, well, he's old enough, he can kind of decide on things. So he may actually get into the launching phase without us being able to recover him because we've run out of time. We shouldn't run out of time. We should be doing this really quickly and diagnosing child abuse. But that's a possibility, in which case he's going to have a failed launch and we have to recover him then after that, when he wants to relaunch and sort of thing. So we carry this further into young adulthood. We never abandon a child to child abuse. That just doesn't happen. So he's the eldest son, and he's in the launching phase is another feature of this. Now, something else here is we have the borderline. We're going to have splitting in the sides. So this family's going to take sides, either the mom's side or the dad's side. And initially, she only needs one regulatory object, and that's Mark, to help stabilize her, and she gets him as a warrior. But once he's solidly in her camp, then the two of them start to work on the other siblings because things need to be consistent. If the two girls are bonded to the dad and say dad's wonderful, and Mark says no, he's bad, then it's Mark's problem, not the dad's problem. So they need all the kids saying it's the dad's problem. So then they'll begin to work on Emma, and then Emma and Mark will begin to work on Lauren, and they'll get everybody over consistently with the mother, and they'll have this narrative that, oh, dad's too angry and he's too controlling, and we need to protect Lauren when she's over there. And Mark says he's not going over, and so Emma, you take care of Lauren when she's with her dad. Now, the other feature about this is that we have a 12-year-old is pre-adolescent, and she's on the high affection bond with her dad. So she's going to be going through the whole adolescence. And we want these daughters to feel loved by their father, especially during adolescence. So the mother-son is white-hot in early childhood. The father-daughter is white-hot during adolescence. That's a period of daddy's princess and father-daughter dances and stuff. So we want a lot of affection coming from the father to the daughters, and that they feel loved by him, because that's the pattern they're going to take out into the world, looking for somebody to make them feel like their dad made them feel. And so we want lots of love coming in here, and it's not headed that direction. So I'm really worried about that. And because we have a 12-year-old, this is a long-term thing. We got to fix this because we can't let it go for years and years and destroy these kids' lives. Another feature about just this pattern is this is going to be the wonderful dad treatment plan. I'm going to have a bullet point on the treatment plan to make dad a wonderful dad. And here's why. One is it's diagnostic, because when I go back to the mom and say, we're going to fix everything, we're going to make dad wonderful, she's going to say, no, don't do that, because he's like, you'll never be able to. Look, you were with him for 15 to 16, 17, 18 years. And all of a sudden you raised 3 children with him, brought 3 children into the world. Now all of a sudden he can't. We're going to fix him. We're going to make him a wonderful dad. The kids are going to go and brag about how wonderful he is to all their friends. And mom's not going to want that, because what mom's issue is, the splitting, is it's an either or thing. So the children either have to be on her side and love her, or they're going to be on dad's side and love him, but they can't be both. That's the ambivalence. And so if they love the dad, then they won't love her. And that's what she's afraid of. So she cannot let them love their father. And that's where she gets Mark away from him. Boom. You're over here with me. So we disrupt that bond, and you can help stabilize me and be my surrogate husband now in the loss of my actual husband. And then she'll work on Emma and Lauren to also come on over and be consistent in that rejection of their father. So we need to fix that. So one of the things about that wonderful dad treatment point, and not only is it diagnostic of the mother as you tell her that and she'll start to spin around, that's actually a treatment bullet point I want. Okay, I want these two girls and their son to have a wonderful dad. Okay, that's a high affection bond. You want them to great. So I'm going to put it on bullet point. We're going to fix dad. We're going to make him a wonderful dad. And that solves everybody saying he's controlling and angry. Well, we'll get rid of it. Okay, it's not hard to do. And so we'll just do that. We'll make him wonderful. And that should solve everything. Right? No, it doesn't, because it's a factitious attachment pathology. Mom's creating it. And so we can change dad and make him just a best dad on the planet. He may already be. It doesn't matter that has nothing to do with dad. It has to do with mom's pathology, mom's needs, mom's emotional needs. So one of the things we're going to do on that, the Wonderful Dad treatment plan, is has to do with 4 organizing intentions. It's not what we do as parents, it's the intention which motivates our action. That's the most important. 2 of these intentions are maturation building. That's the intent to task. That's like homework. I don't care what you think or feel, you do your homework. And the intent to change. That's like, I don't like what you're doing, be different. And both of those put restrictions on the child that force the child to kind of up their maturation level to manage the restrictions and their emotions, regulate their emotions in that. Then the other 2 intentions are relationship building intentions. That's the intent to be with, and that's just wonderful and soft. You just like being with the person. And then the intent to understand. And of these, we want to stop the dad using intent to task and intent to change. He's going to become a very permissive dad. And so we're going to reduce those, because those will get manipulated by the mom. If he tries to put rules on, or if he tries to structure the kids and help them mature, mom's going to say, oh, he's so mean to you. See, he's controlling, Let me say something about that. All parents are controlling. Holy cow, that's called parenting. You got a 5-year-old. Don't run in the street. Put your shoes on. Time to go here. Parents are controlling. That's the job description here. And so for the mother and the kid to say, that's too controlling. He's a parent. Okay, that's a manipulative thing of mom. Oh, I'm so sensitive to you, and he's. Okay, so you have to be wary of the dark manipulation. They are the best manipulators on the planet. But we're going to change the dad. We're going to bring him. We're going to stop using all the discipline practice and stuff. And we're going to shift over and really strongly use an intent to understand. And what that is a simple curiosity. What's it like to be you? And so whenever the child has some difficulty, protest behavior, I want the dad to come over and figure it out. What's it like to be you? What's going on? Help me understand, an intent to understand. And we work on that in therapy and get him good, really good at that. Shift him entirely away from discipline strategies, taking things away and putting on timeouts or anything like any discipline. He's not going to be a disciplinarian. Oh, the kids are going to run wild. Well, that's better than having a breach attachment bond. Get the mom to be the disciplinarian if we need that, not dad. We're going to shift dad entirely over to guidance-based strategies. That will resolve the complaint about him being angry and controlling. He's not angry. He's not controlling. He's a wonderful dad. So now we should see the end of the pathology. If we don't, then it's mom doing it. And even once we get it, I still want him to do this. I want him to be a wonderful dad for his girls and use guidance-based rather than discipline-based. So now with all dangerous pathology, suicide, homicide, abuse, child abuse, spousal abuse, elder abuse, we start with a safety plan, not a treatment plan. We make sure everybody's safe. Suicide, homicide, abuse. So in this case, we have a vulnerable dark triad mother, borderline spectrum. We got a child abuse diagnosis. We need to get that diagnosis, shared delusion, factitious disorder, if it's present. And so we get that diagnosis, and that guides our treatment and our decision making then. We get a protective separation, and we always have to keep in mind we got a dark personality in this family. That's a dangerous parent and pathological parent. So then we bring the 3 children and we reunite on that sibling bond. So again, here when we have 3 children, and right now, in the current situation, Mark is over with his mom and the 2 girls are over. That's a fractured family. I want to get that sibling unit back in place and have put Mark back in the leadership role with his siblings, but not to protect them from the father, because the father doesn't actually represent a danger to them. And so we'll have to work on that issue between the father and son. But I want to rebond, because that's going to reduce Emma's stress, it's going to reduce Lauren's stress, and it's going to reduce Mark's stress to get support from his sisters as well. So we reestablish that sibling bond, a healthy sibling bond, and a healthy hierarchy. And this will also communicate to the children that the father is a normal range, okay, acceptable parent. And that mental health people have looked at it, they vetted the father, and so we're vetting him as an okay parent, because a mom is saying, oh, he's abusive and he's problematic. And no, he's a good dad. He loves you guys very much. He's a nurturing dad. He's a good, and you can bond into him, and we want you to bond into him because he's a good dad. So then when we move into the treatment, most likely I'm going to suggest a contingent visitation schedule on this, where you rate the children's symptoms. As long as they're 3 or higher, everything's fine. But if they drop to 1s and 2s, then we say your mom is doing her problematic parenting again, and we need to protect you. Now, with this is where the child abuse diagnosis becomes important, because when I reach this protective separation and contingent visitation schedule, I am going to go for all 3 of these kids, but especially Mark and Emma, 16 and 14, Lauren 12, is I'm going to go to them and say, after evaluation by the professionals, it is our opinion that your mother's parenting is sufficiently problematic that it represents a child protection response. Okay, that, yeah, she's abusive. Mark will go, oh, she's not abusing, she's wonderful. And you say, well, whatever. We see that as, because what's happening with your dad and that destructive relationship, we attribute to your mom's negative influence. No, she's not. She's telling me to go all the time. And well, we're attributing it to mom's negative influence. But here's what we need from you, Mark. We just need you to be normal range with your dad. So 3, 4, 5 or higher on the 7-point scale. Okay, 3, 4. I mean, just normal range. Just, you're a good guy. We're not nice to other people because of who they are. We're nice because of who we are. So show who you are. Show the quality, your character, your value system. And we just need you to be normal range with your dad. In addition, you're in a leadership role with your 2 sisters here as the eldest son. We need to help lead this family into a normal range and healthy family. And so we're going to ask you to work with your father on that leadership role. Talk about that in a second. But the treatment team needs to be able to go to these children and tell them 2 things, basically. 1, your mother's parenting is sufficiently problematic that we think you need to be protected. And 2, your father's parenting is normal range, and he can be trusted and loved, and you can receive nurture from him. He's a normal range dad. So we need to be able to make those 2 statements as part of things. Now, the other thing I will tell Mark and Emma and Lauren regarding the contingent visitation schedule is that's a way to communicate to us, your treatment team, about what's going on with mom. So you say everything's fine with mom. Okay. Then just be normal with your dad, and that will communicate to me that whatever your mom's doing, you're handling it okay because you're normal range with your dad. But if you drop to ones and twos and stay there, I don't care about occasional ones or twos, but if you drop to ones and twos and stays there, that means your mom is doing stuff and then you're having to take care of her again. And so we'll intervene like that. So, you've done great on this protective separation period. You got we're all up to normal range ratings. So just stay there. Just when mom comes back in the picture, just stay there. And what we're doing with that, too, is we're taking away the mother's motivation to create pathology in the child. Because this pattern here, the parent is creating a factitious disorder to get her own needs met. Abandonment fears and regulatory object in the son, and spousal abuse of the dad for treating her mean and not listening to her, and to manipulate the courts so she gets custody and dad doesn't. So she's using the children as a regulatory object in this situation. And so we're going to need to protect the children and stabilize their healthy development with their father. And the continued visitation schedule is a way for the children to communicate what's going on with their mother without throwing their mother under the bus. So if there's problems, they just collapse. That tells us mom's doing her stuff, and we can, 3 days, successful days, mom gets less time, dad gets more time. We're taking away the mother's motivation to create pathology in the child. No longer is the dad being defined as abusive. She's being defined as abusive. No longer does she get the children. The dad gets less time. Dad gets more time and she gets less time. So we're interrupting all that secondary gain for the factitious disorder, which is the treatment for a factitious disorder. Otherwise, we're always having to prevent mom from trying to get to the kids and stuff. We need to extract her motivation for doing that. And so diagnosis guides treatment. If it's a factitious disorder, this is a treatment. If it's dad's being authentically abusive, then no, that's not the treatment for authentic child abuse. So we need an accurate diagnosis of which parent is causing the problems. Then the other thing, just with this family, I just want to point out, is I would also, there's a role for the therapist going forward relative to the father and mother and stabilizing that and stabilizing the kids within all of that. Because this is a long-term family again. This is a family. And so we need a family therapist in there. It's now a post-divorce separated family, but it's still a family. And so there's a role for the helping of the family therapist to help the family transition into a successful family relationship. Now, finish off here. All therapy should have outcome measures. So if we're doing therapy for depression, what are the symptoms of depression and are they getting better? And in this case, I recommend rating on 3 items: affection, cooperation, social involvement on a 1 to 7 scale, Likert scale. 1 and 2 is awful, 6 and 7 is wonderful, 3, 4, 5 is normal range. Daily ratings emailed to the family therapist. And that serves several functions in child abuse. So if we have a physically abusive parent, I've worked physically abusive parents, we separate the child, maybe foster care, kinship care or something. We separate the child. Now, when we restore with the formerly abusive parent, hopefully formerly we get them treatment, when we restore, we're going to monitor the symptoms of physical abuse. If we see bruises or something, or if we see a kid getting angry and we start to see symptoms of potential physical abuse, whoop. And the other feature about that, though, is it's not our responsibility to place the child at risk. Once they're a parent worried about child abuse, it's not our responsibility to place the child at risk. It's the parent's responsibility to reassure us. Okay, so that's what I would ask for. I would ask the mother to please reassure us that you're not having this negative influence on the child. And one of the ways we're going to do that is we're going to monitor the symptoms of psychological child abuse in this. And the symptoms of psychological child abuse are damaged attachment, damaged cooperation, high conflict, and the avoiding. And so I don't want the daughters going over there and just being in their room and avoiding their dad. That's not healthy either. So I want my kind of gauge for what the treatment goal is is healthy, normal, just normal, healthy, normal. And so is this family normal? No. And let's fix whatever is not normal about this. And it may involve some stages of not normal, protective separation, then restore. But it's always towards getting that normal range, healthy family where the children are receiving love from both parents. And that's my concern. I want children to feel loved by both parents. That's my treatment goal. Normal range childhood for them. So we're going to monitor attachment. That's your affection networks. Cooperation, that's your emotional regulation networks, and social involvement, that's mood and arousal. As long as the kids stay 3, 4, 5, we're all happy. If they drop 1s and 2s, mom's abusing them again. And that's how we deal with therapy and deal with the mom and things going forward. So with that, I'm going to wrap up my discussion of the Williams family, and we'll talk about different variants in other clinical case vignettes. So take care, everybody, and good luck out there.